Do you frequently suffer from a blocked nose, facial pain, headache, or thick nasal discharge? Many people think it's just a common cold, but sometimes the real problem is sinusitis. In today's video, we'll understand what sinusitis is, why it occurs, its symptoms, diagnosis, complications, and how homeopathy approaches such cases. Before understanding sinusitis, let's first understand the sinuses. Sinuses are air-filled cavities present within the bones of the skull. There are 4 pairs. Frontal sinuses, located in the forehead. Maxillary sinuses, present in the cheekbones. Ethmoid sinuses, located between the eyes. Sphenoid sinuses, situated deep behind the nose. These sinuses perform several functions. Lighten the weight of the skull. Warm and humidify inhaled air. Produce mucus that traps dust and microorganisms. Help in voice resonance. Normally, mucus produced inside the sinuses drains freely into the nasal cavity. Sinusitis refers to inflammation of the mucosal lining of one or more paranasal sinuses. When inflammation occurs, the lining swells, drainage openings become blocked, mucus gets trapped, bacteria or viruses may multiply, pressure builds inside the sinus cavity. This leads to pain, congestion, and other symptoms. Think of it like a room with a blocked drainage pipe. Water accumulates, pressure increases, and problems begin. Several factors can trigger sinusitis. Viral infections such as the common cold, bacterial infections. Allergic rhinitis, air pollution and smoke exposure. Nasal polyps, deviated nasal septum. Dental infections, especially upper tooth infections. Reduced immunity. A simple cold may sometimes progress to sinusitis if drainage becomes blocked. Common symptoms include nasal blockage, thick yellow or green nasal discharge, facial pain or pressure, headache, reduced sense of smell, postnasal drip, cough, especially at night, fever in some patients. An interesting clinical point. Frontal sinus involvement often causes forehead pain. Maxillary sinus involvement commonly causes cheek pain and upper toothache. Ethmoid sinus disease may produce pain between the eyes. Sphenoid sinusitis may cause deep headaches felt behind the eyes. Doctors diagnose sinusitis based on clinical symptoms, physical examination, nasal endoscopy when required, CT scan in chronic or complicated cases. Based on duration: acute, less than 4 weeks; subacute, 4 to 12 weeks; chronic, more than 12 weeks; recurrent, several episodes per year. Most cases recover well, but untreated severe sinusitis can spread to nearby structures. Possible complications include orbital cellulitis, vision problems, meningitis, brain abscess, bone infection. These complications are uncommon but require urgent medical attention. Now let's talk about the general management of sinusitis. The treatment depends on the cause and severity of symptoms. Adequate hydration: drinking plenty of water helps thin the mucus and improves drainage from the sinuses. Steam inhalation: warm steam can help relieve nasal congestion and improve comfort. Saline nasal irrigation: using saline nasal sprays or nasal washes helps clear mucus, allergens, and irritants from the nasal passages. Avoid triggers: try to avoid cigarette smoke, dust, pollution, and known allergens, as these can worsen sinus inflammation. Adequate rest: proper sleep and rest support recovery and strengthen the immune system. Management of allergies: if allergies are the underlying cause, controlling them is essential to prevent recurrent sinusitis. From a homeopathic perspective, treatment is individualized. Instead of prescribing a medicine solely based on the diagnosis of sinusitis, the patient's complete symptom picture, constitution, and modalities are considered. Some commonly indicated remedies include Kali bichromicum, thick, stringy, ropey nasal discharge, pain at the root of the nose, and sinus fullness. Pulsatilla, thick yellow-green discharge, blocked nose, symptoms worse in warm rooms and better in fresh air. Belladonna, acute congestion, throbbing headache, redness, heat, and sudden onset of symptoms. Hypersulphurous, marked sensitivity to cold air, painful sinus infections, and tendency towards suppuration. Sinusia, chronic recurrent sinusitis with persistent discharge and slow recovery. Homeopathic treatment should always be selected according to the individual patient's symptom profile under the guidance of a qualified practitioner. Sinusitis is a common condition that can significantly affect daily life. Understanding its causes, symptoms, prevention, and available treatment options helps in early management and better recovery. If you found this video helpful, don't forget to like, share and subscribe for more medical and homeopathic educational content. Follow at Shilpa Dias for more health and homeopathy updates.